Welcome back, everyone. We're going to continue the lecture in the medication series by discussing some common EMT medications. As a reminder, that medications discussed here in this lecture are intended to provide a brief overview of some of the common medications in the noted area of study and are for education purposes only. Please remember that allowed medications, their specific doses, indications, and uses are subject to individual states, EMS services, and medical control physicians. Always follow your local and state policies, regulations, guidelines, and protocols for specific medications that are allowed in your service area. The first medication we're going to discuss is Epi 1 to 1000. The indication for this subcutaneous administration of epinephrine is for anaphylaxis. Contraindications are for any patient with known cardiovascular disease, but it will be relative to the state of patient presentation, given anaphylaxis in the severe nature can be incompatible with life. Side effects for this medication include tachycardia, hypertension, anxiety, cardiac dysrhythmias, tremors, and dyspnea. Dosing for this medication is 0.3 to 0.5 milligrams administered subcutaneously. Naloxone, or Narcan. Indications for this medication are opiate toxicity with respiratory insufficiency. The patient should be suspected of opiate toxicity and have respiratory compromise prior to administration. Contraindications for naloxone are hypersensitivity and using caution with patients with who are narcotic dependent and may experience withdrawal symptoms, to include neonates of narcotic dependent mothers. Side effects of this medication administration include withdrawal symptoms, dysrhythmias, nausea and vomiting, hypertension, tachycardia, seizures, and blurred vision. Dosing is 0.4 to 2 milligrams, and it should be titrated to respirations. The goal in administration of naloxone is not to awake the unconscious patient, rather to restore respiratory drive on their own. Albuterol. This is a beta-2 agonist, and its indication is bronchoconstriction, most commonly seen in patients with exacerbation of COPD or asthma. Contraindications for this medication include hypersensitivity, and use should be given in caution with patients with cardiac dysrhythmias. Side effects include tremors, tachycardia, hypertension, anxiety, nausea, headache, palpitations, cough, and dizziness. Dosing is 2.5 milligrams diluted in 3 milligrams of normal saline, typically administered through a nebulizer, and repeat as needed. Most preparations of this medication come pre-mixed. Normal saline and lactated ringers. Normal saline and lactated ringers are isotonic solutions used to treat hypovolemia and perform fluid resuscitation in the hypovolemic patient. Contraindications for this medication include fluid overload and pulmonary edema, with side effects being hypertension and pulmonary edema. Dosing is 20 milliliters per kilogram bolus for fluid resuscitation. Dextrose 50% and dextrose 10%, also known as D50W and D10W respectively. The indications for this medication is hypoglycemia, and it's administered intravenously. Contraindications are hyperglycemia, with side effects being hyperglycemia and thrombophlebitis. The adult dosing is 12.5 to 25 grams slow IV push. This is 25 to 50 milliliters of 50% dextrose, or D50, and 125 to 250 milliliters of dextrose 10%, or D10. Glucagon. Indications for glucagon are hypoglycemia when IV access is not available, as this medication is administered intramuscularly. Contraindications include hypersensitivity, with side effects being tachycardia, hypotension, nausea, vomiting, and urticaria. Hypoglycemia dosing for these patients are 1 milligram intramuscular and may repeat in 10 minutes if your protocols allow. The last medication that we'll discuss for AEMTs is nitrous oxide. The indication for this is pain. Contraindications include altered level of consciousness, hypotension, chest trauma, specifically with pneumothorax, a COPD, abdominal pain or injury, head injury, or bowel obstruction. Side effects include altered level of consciousness, apnea, dizziness, nausea and vomiting, and malignant hypertension. Rare, but a serious side effect nonetheless. This medication is dosed by self-administration of the patient holding a handheld mask or mouthpiece until the effects are felt, and they should remove the mouthpiece from their face. If a patient loses consciousness during administration, the nitrous oxide should be removed from the patient's hand and removed away from the patient. Be mindful that it may inhibit respiratory effort, and you may need to assist ventilations with this patient.